Today we're going to talk about one of the most important aspects of life, which is diet. I'm going to try to give you recommendations when I'm talking about diet and plastic surgery, but in fact, diet is perhaps one of the most important things you have to be educated on because there is not much information out there. Now, let's start from the very beginning. When you're a child, which are usually at this point, if you are watching this video past that time, but I'm sure you're going to have kids if you don't now, and your kids are usually below 6 years old, and it's very critical and very important that you understand that. This is a time of development that you will grow your fat cells and you will multiply them. So if you are an obese kid below 6 years old, you created so many fat cells. These fat cells are going to be with you forever unless you remove them later some way or another. But what happens is that patients that have the tendency to become obese is because they were obese in the past, because they created so many fat cells, and now they have a tendency to gain weight easier. Now, this gain weight not only happens under the skin in the fat tissue, but also happens inside your abdomen, where it's more fat tissue, in your heart and in your organs, in your liver, in your kidneys, everywhere. And this predisposes you for having other diseases and problems in the future if you are to gain weight. Now, having said that, I'm going to tell you more about what is important around the plastic surgery time. So, it's important to understand that the best result you're going to get is the closest to your ideal body weight. Your BMI is very important, your body mass index, and the closest you are to your ideal BMI, the best your result is going to be. Sometimes you have to gain some weight if you are very skinny and you are looking into fat transfer, for example. In those cases, you might want to gain some pounds, 10, 20 pounds, just to be able to redistribute that fat into other areas that you're interested in. But for the most part, it's very important that you are in your weight or closest to it. Your result is going to be the best. In many occasions, you can get to that also after surgery. So let's say you had to lose 60 pounds and you lose 30 pounds and then you get the surgery. It's important that you lose the rest of the 30 pounds later in your surgery, because your result in that range is probably going to be okay. And it's going to be good, and it's going to be much better the closest you get to your ideal body weight, even if you get to it after the surgery.